Hello everyone, hope you're doing well and staying safe. Today's topic is about passive immunity.
For our new viewers, don't forget to subscribe, like, and share to stay updated with every single video we download on our channel.
Our table of content for today's video is to talk about the mechanism of passive immunity and when it is useful to be used. To start with, we're going to explain the start of methods when talking about passive immunity, which is a plasma therapy, a therapy that we transfer a fluid part from the body, blood that rich in antibodies, and transfer it to person that's lacking or under specific conditions and incapable of producing antibodies for specific infections. So we give them ready antibodies that will fight the pathogen directly, and we will talk about the conditions more profoundly in a few minutes. Great. Let's talk more deeply about what is plasma therapy. Here we have the first step, which is a healthy immunized person that has immunity against that specific disease or specific infection, either through natural infection, which is acquired the pathogen directly from direct contact or according to the type of transmission for that specific disease, or through vaccination. So his body already encountered that specific pathogen, recognized it, built immunity against it, so there is antibodies and there is memory cells that are stored for future infections. Here we have in front of you a test tube that is centrifuged, which means the RBC part, which is the red part, is separated from the other particles of the blood, where blood is a mix of plasma and RBCs. Plasma, 90% is water and 10% products like proteins, antibodies, carrier proteins, enzymes, and a lot more. When we centrifuge it, which means we put it in a specific machine that stir it around in a very fast way, like at a specific speed, that will separate RBCs and put them at the bottom of the tube where they are heavier, and the rest will be the plasma. And in between the yellow part, which is the plasma, and the red part, which is the RBCs, there is a fine line that maybe it isn't visible for you right now, which is the buffy coat, where it contains white BCs, white blood cells, and platelets. Amazing. So after we centrifuged the test tube, the blood tube, of course, in this tube we have anticoagulant, mainly EDTA, where we want the plasma, which means to not have a clotted sample, where, as you know, the blood give us serum and could give us plasma. Serum, it was centrifuged in a tube that don't contain anticoagulant, which means the clotting factors were activated that are already present in the blood and clotted the sample. However, when we needed plasma, we needed it free from clot. Why? In order to separate it from the RBCs and don't have any inclusion in the plasma. So we put it in a tube containing anticoagulant in order to have plasma. After the centrifugation, we will take that plasma from that immunized person. Of course, when I'm saying the plasma from an immunized patient, which means he didn't acquire the infection maybe a couple of years ago. Of course not. It's window of infection from 15 days to 2 months maximum. Of course, preferred not more than 1 month because antibodies will be more fresh and abundant. Great. After that, we will take that plasma from that immunized person that already contain antibodies for that specific infection because it was a recent infection. Those antibodies then will be injected into the blood of a sick, non-immunized patient. So this patient could be immunocompromised, not that much competent to produce antibodies in a fast way, the infection, risking his life in order to be hospitalized. And, to get an immunization against a new pathogen, it takes about 15 days for your body to recognize it and to produce antibodies. So 15 days are really crucial. If the person isn't that much with good immunity, will put his life under risk. So we give him a straightforward antibodies in order to fight the infection on the spot and prevent or try to limit any kind of drawbacks that could put his life under risk. But also there is other forms of passive immunity, such as maternal antibodies. When the mother breastfeeds her baby, she is transferring with the milk maternal antibodies that will protect the baby from any infection in the first weeks of birth, because at that time the baby's immune system isn't ready yet to produce antibodies and immunity against a specific infection. So breastfeeding is really important to protect the baby from any infection that could acquire, because as you know, newly born babies are under risk of getting infection because there's visitors to congratulate on the birth of the baby that will contract a specific infection or pathogen. Also pregnancy, through the placenta, there is also the flow of antibodies into the baby, where if the mother contracted a specific infection, the baby would have immunity against it. But of course, it's a maternal immunity, like from the mother's side, not from the baby's own body at that specific age. When it is used, the plasma therapy, such as, for example, immunocompromised, as we discussed previously, and the snake bite. Snake bite is an example of when we use ready antibodies. Of course, there's a drawbacks about plasma therapy is that it's a short-term immunity, which means we give you the antibody because you were under risk of having severe symptoms and not enough time to avoid them until your body produces your own antibodies. So we gave you that antibodies. But at the same time, after 15 days to 2 months, the antibodies that were transfused to you from another person won't be present anymore. Which means if you get contracted that specific infection another time in the future, you should build a new ready immunity, because we're not giving part of the pathogen, such as in vaccination, plasma therapy. However, we're giving an antibody, and your own body will recognize that antibody but won't produce immunity against it or copy of it. There's no pathogen that the body recognized, the immune system recognized to produce antibodies against it and memory cells. So the plasma therapy won't produce memory cells, which means future infections, you need to get your own immunity or through plasma therapy. Those are the drawbacks of plasma therapy, that it is not a long-term immunity.
By this, we will end today's topic. Hope I make it easy for you. Thanks for your time. And don't forget to subscribe, like, and share.